Now, how are private hospitals doing amid the surge in COVID-19 cases? Joining us live via Zoom is Dr. Jose de Grano. He is the president of the Private Hospitals Association of the Philippines. Good morning, Dr. de Grano. Thank you so much for joining us.
Yes, good morning, Ms. Ria, and thank you for having me here.
Doctor, we reached another grim milestone yesterday at over 8,000 cases. How is this surge affecting private hospitals at this point? What can you tell us about the occupancy rates?
Well, right now, especially in the National Capital Region, it is if we can say, very alarming because previously, a week ago, there were only around 27 or 20 facilities which are in critical level. Right now, it has almost doubled. 37 facilities are in critical level, and when you say it's critical level, it's beyond 85% capacity, or most of them are 100% or really full capacity. So that has really worried most of our private hospitals, and probably even the one hospital command center. They have to worry about that. Where are they going to send the excess or the spillage from these private hospitals?
That was exactly my next question, Doctor. What is the plan in place if ever hospital beds do get full? I think the DOH has urged hospitals, both public and private, to allocate more beds. What is your take on that? And do private hospitals even have enough resources to do that?
Well, actually, the Department of Health has mandated previously that at least 25 or 20% of our authorized bed capacity should be given to COVID patients. Well, of course, we are trying to manage that most of the time. But right now, they are asking to increase it to around 30%. The problem is we have manpower problems, especially with nurses. If you would note the number of nurses since even before pandemic has dwindled down. Mostly, it is because of our nurses going overseas, and then during the pandemic, the government has asked them to go to government facilities also, and so because they were offering higher pay for these nurses, and so what's left to the private hospitals are only probably 80% of the previous number of nurses that we have. So we were really trying to cope with this increase in the number of cases, but of course we are limited as to just the manpower complement that we have presently. These are the private hospitals.
Doctor, the government has imposed a bubble in the greater Manila area, and several businesses have already reduced their capacity again. Do you think that these new restrictions are enough to curb the spread of the virus?
Well, of course, I think that will help a lot in the sense that at least there will be less interaction between people, and we'll be able to control the spread of the disease. But what is important is for people to really comply with the minimum health care protocols. And that is what is very important, of course, especially in the light of these new variants.
All right, Doctor, do you have any other recommendations to government? What else can be done to really bring numbers back to a more manageable level?
For the government, well, of course, we have to enforce strictly the compliance of our people to these minimum health protocols. Probably then, if there is spillage within National Capital Region, then we have no choice but to spread this to the surrounding regions through the one hospital command. And I think right now that is the some are suggesting that government can complement this by uh, uh, giving the nurses who are employed in the different government agencies who are not working as nurses to give them or to lend them to private hospitals. But that is, of course, that should be voluntary on their part.
All right, lastly, Dr. De Grano, Octa research predicted by the first week of April, 100% of ICU beds in Metro Manila will be full. Can you tell us, as far as the private hospitals are concerned, do you know how many hospitals have their ICU beds full already?
Well, a lot of hospitals, especially here, most of the hospitals, especially in the National Capital Region, are full, especially for their ICU. Although, if you will note, the disease is 96% mostly mild cases, and only around 1 to 2% are the severe and the critical cases. But if you will note, it's only usually the ICU beds are only around 10% of the total COVID bed capacity of every hospital. They do not have enough ICU beds, especially, of course, the equipment that we have is only very limited also. So we get a lot of these critical cases.
All right, thank you for your time this morning, sir. That was PHAPI President Dr. Jose De Grano.